what is the latest real-world data telling us about the vaccine's effectiveness? I see that in Scotland, researchers are suggesting the vaccine has led to a significant decline in both infections and hospitalisations after just the first dose.
That's right. I think there are two interesting sources of information from the experience of other countries. Probably the most data on the Pfizer vaccine is coming from Israel. Now, they've given almost 50% of their population at least one dose, and they have agreed with the company, Pfizer, to share all their data, and it's very promising. For example, in around 6,000 health workers, between 14 and 28 days after their first dose, there was a reduction in transmission of around about 80 to 90%. That's very reassuring. In a separate study in Israel, again, 15 to 28 days after the first dose, there was a huge reduction in viral load in those that were infected, meaning that they will be much less infectious. So, we know that some people who get vaccinated will still get infected, but they will be much less infectious than if they had not been vaccinated. The second very valuable information is coming from the US, where they have vaccinated around 40 million people. Now, the Centers for Disease Control has a very good and mandatory surveillance system for side effects. And they've found so far that around 1 in 10 people get very mild side effects. And that's usually a headache, a low fever, maybe soreness and swelling at the injection site. And about 1 in 100 get more severe side effects, but still not something to fear. And that's nausea, poor appetite, maybe weakness, and maybe some bowel upsets. What is really important is they have not yet detected any unanticipated rare side effects. Some people were, for example, fearing the Guillain-Barré syndrome, which causes paralysis. There's not been one case in the US.
So, Mike, from that information that we're seeing coming through from overseas, could we then go towards a point where one dose could actually be enough to protect some people in a context of a world that has limited supply at this point? Could it be better to have more people with just the one dose instead of focusing on getting the double dose?
Well, I think for the moment we should follow the advice of the Therapeutic Goods Administration, which for Pfizer is to have a second dose at 4 weeks. So I think it would be premature to meddle with that recommendation. Of course, we haven't yet received the AstraZeneca vaccine, and there's not as much real-time data coming out on that vaccine. We're still relying on the company to provide us information from the clinical trials. So I think we're in a good position, having probably by next month 2 vaccines to roll out. And let's not forget that by the middle of the year, we may have a very good third option, and that's a vaccine called Novavax. Australia has ordered 40 million doses this year, with an option for another 10 million next year, which would be enough for the whole population. Now, according to the Novavax trial in the UK, it was 89% effective, even with the UK variant of the virus. Now, their trials in the US and Mexico are not yet complete, and they will wait for the results of those trials before they apply for approval in the US, UK, and of course, Australia. But it's a very good option that's up our sleeve, something to look forward to.